Hello, this is Congressman Brad Sherman. Welcome to our San Fernando Valley Telephone Town Hall. This is a time of a great health crisis and a great economic crisis, and I'm glad that you are able to be with me here tonight on the telephone. This is our third coronavirus crisis town hall, and we'll be doing a fourth one on May 5th at 7 p.m., and it's my expectation that we'll do it every other Tuesday until we can all meet at a Dodger game. Hopefully we'll be able to meet at a Dodger game, and hopefully I won't be repeating that, talking about a Ram game. In any case, we're going to have a number of guest speakers here tonight, and if for any reason you are cut off and you want to rejoin the call, jot down this number, 877-229-8493, and then you enter the PIN number 13402. Once again, the call-in number is 877-229-8493, and the PIN number is 13402. And those numbers are not just good for tonight, but you can wait till 7 p.m. on May 5th and dial in using those numbers again. Now, the way this telephone town hall works, you can just sit back and listen. If you want to reach a question to reach my staff or to raise your question with thousands of Valley residents, you dial *3. That's *3 on your phone. You'll be connected to my staff. If you want to just talk to them about a personal issue that has come up, you can do that. But most people who dial *3 will want to be placed in the queue so that we have a chance to get to your questions. We will also be answering some of the questions that were submitted in advance by people who RSVP'd for this evening. Now, I'll be introducing four guests in a bit. We'll have two medical guests to start off, then we'll take some questions, and then we'll have a representative of both the state and the city government to focus on things from their position. That, of course, is Assemblyman Adrin Nazarian and Councilman Krekorian. The Senate passed a bill today, and the House will pass this bill Thursday. This is the fourth bill, all major pieces of legislation that have been passed about this crisis. Let me review what's in this bill. There is $310 billion out of a total of $484 provided by the bill that goes to the Small Business Paycheck Protection Program. And that is the program that loans money to businesses with 500 or fewer employees. There are special rules there to help hotels, restaurants, and automobile dealerships, so that for those types of businesses, if you have fewer than 500 employees at a particular location, that counts as a small business. Whereas for every other kind of business, just about, you look at all of the employees of the enterprise nationwide. So small business has its own definition. If you get one of these loans, and over $359 billion, I believe, $349 billion has been dispersed already, or at least spoken for and obligated. You're supposed to use 3/4 of the money to pay your payroll during an 8-week period, and the other 25% for other fixed costs, rent, mortgage payments, utilities. If you do that, then the loan is fully forgiven. So this has been an incredibly popular program because it's not really a loan program. We call it a loan program. It's really a conditional grant program. And so it is supposed to end up being free money to most of the small businesses that get it. It has been very popular. It was oversubscribed in about a week and a half, or depending upon how you look at it, maybe even less than a week, when we put in the first $350 billion, and that is why we have put in more. We have also provided additional $60 billion for other types of SBA loans to small business. There is the SBA Economic Injury Disaster Loan which is a loan but under very generous terms, and as much as $10,000 can be a grant, and so that, of course, is a popular program as well. This one thing to point out about the PPP program that's different is that the Republican position was $250 billion into the program, just the way it worked the first time. Democrats went along with that as long as there was another $30 billion made available to borrowers who go to credit unions and other small financial institutions, and another $30 billion for community lenders and community development financial institutions. So that what we found with the first money is that the vast majority was being lent by the biggest banks to what I'd call the biggest of the small businesses. And with the special rule we had for restaurants, some of the biggest of the small businesses are pretty big companies. So we wanted to make sure, Democrats especially wanted to make sure, that those who have a relationship with the small financial institutions were able to get one of these PPP loans. Then there is we provided $75 billion for hospitals who are on the front lines, and another $25 billion for testing. This is to manufacture and distribute the tests, to pay the tests for test costs for anybody who's uninsured. It's $1 billion for contact tracing, so we know somebody's positive, we then go test the people they've been in contact with. It's $1 billion to do research on how to develop a rapid test. We have one rapid test now. It's rapid in the sense that you get the results in 10 minutes, but it's not rapid in the sense that, well, while the machine is testing you, the next person in line has to wait. So it's a test. It's a machine that can only do 5 tests an hour. What we need is rapid mass testing. And then what isn't in this bill, and the thing that I've been fighting for, is money to do research to determine what cures, preventative measures, and treatments are available. When it comes to that kind of medical research designed to beat the disease, less than 1/10 of 1%. That's less than 0.1%. One out of every $1,000 has gone to medical research to actually beat the disease. I do want to point out some other things are going on outside of this bill. The president has announced a immigration ban for 60 days. This is outrageous. This is something he has always wanted to do. It doesn't really make sense as part of a coronavirus response. The second thing is that the price of oil at the wellhead here in the United States has dropped to about zero. Maybe $10 a barrel, maybe zero, somewhere in there. This has not been passed on to consumers quite as much as it should be. Gas prices aren't that low at the pump. But this is an opportunity for the United States to fill our strategic petroleum reserve, because a lot of us remember oil shortages and oil shocks. The way to protect us from that crisis, and now is a time to be in favor of protecting America from a variety of different kinds of anticipatable crises, is to have a strong strategic petroleum reserve. So I came out and said we ought to buy the 75 million barrels that we could use to fill, and the administration has decided to do just that. So now and then I advocate something, and the administration goes in that direction. And then finally, with regard to the economic impact payments that are being made for COVID, this is the $1,200 per adult program. The Republicans demanded a provision that is designed to prevent not only undocumented immigrants from getting these funds. But even the spouses of undocumented immigrants, that I think is outrageous. It may eventually be determined to be unconstitutional, although when it comes to tax matters, the Supreme Court pretty much is reluctant to say that anything is unconstitutional because there is a specific amendment, the 16th Amendment, that says that you can have an income tax and vest that power with the federal government. One practical bit of information, and I don't know how many people this will apply to, but if you are in a mixed status family, one spouse has documents, the other doesn't. One spouse has a Social Security number, the other doesn't. You might look at filing separately, married filing separately status for your federal return. Wouldn't do that for the California return, but for the federal return for 2019 if you haven't filed. And you know the tax deadline is July 15th, so a lot of people haven't filed yet. So you'd want to at least take a look at that. Very rarely do happily married couples file separately, but it may turn out to be your advantage. I have, of course, supporting legislation to eliminate this travesty. When you have a U.S. citizen married to an immigrant, the solution is not to treat the U.S. citizen as an illegal immigrant. The solution is to treat the married couple, is to provide immigration status and ultimately citizenship to the other spouse. The idea that you would separate a legitimately married family is I think, inconsistent with human rights. So that went over by a couple of minutes. I'm now going to recognize Dr. Yadegar, who heads the intensive care unit there at Tarzana Medical Center, and who also is a pulmonary critical care doctor. And I think he can tell us a little bit about what the resources are there at Tarzana Medical Center, what happens if you get sick, and whether the hospital is overwhelmed or whether they can do a good job of taking care of you. Doctor, why don't you tell us a little bit about it?
Thank you, Doctor. Thank you, Congressman Sherman. Yes, my name is Thomas Yadegar, and for the past 10 years, I have been the medical director of the intensive care unit at Providence, Cedars, Sinai, Tarzana Medical Center. I am currently serving as the COVID commander and responsible for the care of all the inpatients with the diagnosis of COVID-19. I wanted to first express my gratitude for the social isolation policy as well as the shelter-at-home policy. There is no doubt in my mind that this policy saved lives. It also, by flattening the curve, it allowed us to not become overwhelmed and gave us time to organize and prepare. Currently, we have our patients with COVID-19 isolated from other hospitalized patients. We have them in a separate intensive care unit as well as a separate floor if they are admitted to the hospital. Once the patient comes into the ER and then is determined to need hospitalization, the team that I supervise and organize gets called. At that time, we admit the patients to either the intensive care unit if they're in a critical stage, or to the hospital floor. The protocols that we follow are mandated by our Providence system-wide. Initially, any patient that was being admitted to the hospital with the diagnosis of COVID-19 was getting a combination of hydroxychloroquine as well as azithromycin. Currently, the azithromycin has been deemed to be non-beneficial, and I think as of today we are switching so that will not be included in the cocktail. Besides the hydroxychloroquine, patients do also receive supportive care with oxygen as well as inhalational therapy if necessary. One of the large shifts that has happened in therapy over the past month has been initially we were told that these patients become very hypoxic, meaning they have a very low oxygen level. And once that happens, that we shouldn't bother with other conserving measures and that they should be placed on a ventilator immediately. This was the report from China, from Italy, and also from up north in Washington. So in our first few weeks, we did follow this protocol. And when the patients became sick and decompensated and had a low oxygen level, the usual alternative therapies that we do, we kind of forwent, and we placed patient on a ventilator. It, however, became soon apparent that that was not the right move. The patients actually got worse on a ventilator, and most of the patients required prolonged mechanical ventilation, anywhere between 2 to 3 weeks.
So doctor, you're not using ventilators as much. Is there a shortage of ventilators there at Tarzana?
We actually do not have a shortage of ventilators. What we did was we noticed...
We talked earlier, you have about 8 verified COVID patients at the whole hospital. Is your hospital overwhelmed, or if I need medical care, should I figure, well, I can go on in and get medical care? I'm not displacing anyone. I'm not going to catch COVID on my way in. If I have a reason to come to the hospital, should I come?
Absolutely. I want to stress that social isolation should not mean medical isolation. Over the past few weeks, we have seen patients that should have presented much earlier delayed coming into the emergency room because they were concerned about catching and contracting COVID. We've had patients, young patients, that have presented with appendicitis that have ruptured. We have patients that have presented with myocardial infarctions in late stages and have subsequently...
So if you have chest pains that would have taken you to the ER 3 months ago, you should go to the ER now for your chest pains. You're less likely to get COVID in the Tarzana emergency room than you are at Ralph's, because you're taking care of things. I know a number of people have joined us since the introduction, so I want to welcome the next group of people to our San Fernando Valley COVID crisis town hall, and let you know that we'll be doing another one of these 7 p.m. May 5th, 2 weeks from today, and that at that time, or if you get cut off this time, you can dial 877-229-8493, PIN number 13402, and finally, but most importantly, if you have a question, you'll want to dial *3, and we'll get to as many questions as we can. But we have a lot of very informative guest speakers with us, and at this point, I want to go to and Doctor, I want to thank you for staying on this call through the end of the town hall, so that as questions come up that are relevant to you, you can chime in. And we are a little bit behind, so I'll recognize for 2 minutes Dr. Francine Hanberg, who is an infectious disease specialist, a graduate of Stanford University School of Medicine, and is affiliated with Providence St. Joseph Hospital there in Burbank. Francine? And I should, for the record, point out Francine and I have been friends for, I think it's about 40 years. Go ahead.
That's about right. So thank you, Congressman, for inviting me. My goal is to present why we have reasons to be optimistic, and I say this from a perspective of an infectious disease specialist. And reasons to be optimistic about getting back to normal life, and that we can do it relatively quickly if we're all diligent and understand and follow what follows. So I also have this perspective of somebody in a similar situation. I just graduated medical school when the first cases of AIDS appeared, and I worked for 6 years in San Francisco in the 1980s. And what's similar is the situation seemed very out of control, and there's many differences, but what is similar is back then I was confident that we would find a way out in the same way I'm confident now. And what's similar is we have the viral genome. In both cases, we had the viral genome, and we understand what the parts of the genome do. So with that, we can create drugs that make sense. And but we're already moving much faster with this. The progress we've made with this, I've never seen in my professional career. And I know it's never soon enough. And we all want to be done with this tomorrow. I hate being locked up and not going to the beach as much as anybody. But we will have reasons to step back and be grateful when we look back at this. So how do we avoid getting to a surge, which is what we saw in New York City, where they rapidly went up to 125,000 cases just in New York City? And the good news is they're rapidly decreasing for at least a week, and they're under 500 new cases a day. And for them, that's a big accomplishment. But what we want to do is accomplish the dropping like a stone, like they're doing. And we have some changes to make to get there, but I'm optimistic. We're on our way, and I know the people on this phone call are very motivated and will pass on this perspective to others. So just as a reminder, where we are today, 46 new deaths, 663 total deaths. This is all Los Angeles County alone. We're at 15,000 cases total, and hospitalized patients are 25% of all known positives. So if you get a diagnosis, you're likely to end up in the hospital 1 out of 4 times. And 11% of the patients have no underlying conditions. And I emphasize that because there's a lot of people who think, I'm fine, I'm healthy, I don't have to worry about this. Well, that's not true. And half the hospital patients in this state and country are between the ages of, there are 20-something, 30-something, 40-something-year-olds who think that this problem doesn't affect them. And the reason it's so important is not just that they are half the people in the hospital, and of course they're spreading it to others, but we need to recruit them so that they do the things we need in order to get our cases to drop like a stone. And I know we can do it, and we can do it soon if we do these things. So I want to tell you about the role of
Francine,
testing.
Francine,
Yeah.
I want to chime in because you gave the numbers for LA County. I should also give those numbers for the San Fernando Valley. We have a total of 2,862 confirmed cases in the valley. Just today, there were 331 new cases. That's higher than it's been. We're a little less than 20% of LA County, both in new cases and in total cases. The last 2 days for LA County and for the San Fernando Valley have been particularly high, but I'm told that is in part because some old information just came online the last couple of days. But the new cases, there have only been 2 days where the reported new cases have been over 1,000 in LA County, and those 2 days were today and yesterday. So I'm hoping very much that is a statistical anomaly. But the time will tell. Go ahead.
So what we've been seeing in the last week is about 500 new cases a day, and that's almost every day for the last week. And it's the fastest we've been going up, and that's why Mayor Garcetti looked very brokenhearted, along with we doctors. And so that's been going on for a week, and the question is, how do we flatten that? And in order to do that, I'd like you to understand, and people are talking a lot about testing and a vaccine. So about testing, the antibody test right now is a tool that will be useful more later. And I think people shouldn't focus too much on it and let the scientists work it out. Right now, one of the problems with it
and Francine, if I can chime in, there are two types of tests. One is the antibody test that says you've been exposed to the disease, your system has built antibodies, and you can hope that you can't catch it again, although Francine may give us some caution there. The second kind of test, and the kind of test that's far more prevalent, is just to test to see if you have the disease. And if you had it and you don't have it anymore, you're going to, I believe, register negative on that. But Francine's talking about the test, have you had it, as opposed to the more common, do you have it test. Go ahead.
Right. So people are talking a lot about the antibody test as a possible way to determine when cities can reopen. And the scientists working on it at Harvard and MIT really, one of the lead scientists was interviewed yesterday that I watched, and he really wants to caution people that we can't assume because you have antibodies that you're going to be protected, one, from getting it again or giving it. That is, people may be antibody positive and still giving it to other people. So that's the case with HIV, for example. You have a positive HIV test, and you're not on treatment, and you're highly contagious. So we need to keep that in perspective, and I say that has more of a role down the line. And keep in mind that it's not clear.
Dr. Hanberg, I do have to open it up to questions from the audience,
sure,
because that's what people particularly like about these telephone town halls. I want to thank you and Dr. Yadegar for staying on in case we get a question that's relevant. Don, why don't we go to the first question from our audience? And folks, if you do want to ask a question, you dial *3.
Okay, Congressman, we have a question from Canoga Park regarding the unemployment benefits.
I'll deal with the question, but pretty soon we're going to have Adrin Nazarian, Assemblyman Adrin Nazarian, who's our expert on that because it's a state-administered program. But go ahead.
Shalimar, you should be on.
Hi, Brad. Thank you so much for doing these town hall meetings. I'm sure they're very much appreciated by everyone. I know that I'm happy to hear about them. My question is, I had filed for unemployment back on March 30th. I'm still waiting for my first check to come in. And no matter how much research I have done, I have been unable to find any information on exactly how the extra $600 would be distributed that we're supposed to be getting per week. I haven't been able to find anything anywhere, and I don't know if it's supposed to come in with an unemployment check, or if it was going to be distributed, say, the same way the federal government put in our $1,200 stimulus checks, which I did get. So I was just curious about how that was.
We're going to have Adrin on, who this is different in all 50 states. We've worked hard to provide the money to the states. It should be part of the same disbursement, but some states may be doing it as two separate disbursements. And the answer is that Adrin would know more about that than I would. We'll stay on the line because I'm going to be addressing that kind of question to Assemblyman Nazarian within the next 10 minutes.